And back to the coronavirus. For more on this rise in cases and what we can expect moving forward in this pandemic, infectious disease Dr. Todd Ellerin joins us now. Some epidemiologists are attributing the increase in cases to states loosening stay-at-home orders and public gathering restrictions. With the curve never fully flattening, are we potentially setting ourselves up for a bad fall when other respiratory ailments kick in?
We definitely are, Lindsay. Remember, we know what causes transmission. Large crowds, mass gatherings, people close together, not socially distancing, not wearing masks. As we see cases going up, and more importantly, hospitalizations and deaths going up in certain states, very concerning. And as fall comes and we're expecting other respiratory viruses, this tale of two viruses could be deadly.
And we just heard from the White House administration that they said that they're not expecting a second wave. You disagree with that?
Well, it would be unusual. Most pandemics that we've seen in the past century have had second waves. I expect it. Are we seeing one right now, or is this a continuation of the first wave? Some of that may be semantics. The bottom line is we're seeing more cases, more hospitalizations, more deaths. There are about 1,000 patients, Americans, dying a day from COVID-19. We need to do better.
NIH Director Dr. Anthony Fauci warns that attending political rallies is, quote, risky, yet President Trump plans to hold his first rally since the pandemic's outbreak next week. What's your advice for people who are hell-bent on attending a rally or attending a large gathering in general?
Right. I mean, rally at your own risk. Remember, you're getting into a crowded place, lots of people. There may be people with chronic conditions, the elderly. You really have to think twice about going there, especially if you have chronic conditions or are elderly. Also, really important to wear that mask. If we're opening, studies have shown that masking reduces viral transmission. It slows this virus.
And you've worked with COVID patients for several months now. What would you say that you've learned most recently about the virus based on seeing firsthand how it affects people?
Yeah, this is a really wily virus. I would say the two problems are the amount of inflammation that patients can get, especially those patients with metabolic syndrome, diabetes, high blood pressure, obesity, chronic heart disease. So it really becomes very inflammatory and can be deadly. The other part is the emotional toll. It's that you have patients that are hospitalized with COVID-19 and their family members can't visit unless they have critical illness. That type of separation that we know is important to prevent viral transmission has taken a real emotional toll. It's a tough combination.
Dr. Ellerin, thank you as always for your insight. We appreciate it.
Thank you, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.